we're trying to dig in a little deeper to find out what's going on immunologically.
Even before he finished his residency, psychiatrist Andrew Miller got his first government grant to study the immune system and its relationship to depression. More than a dozen clinical trials, a multitude of studies, and over 350 papers later, Miller is a global expert on inflammation in the body and its relationship to depression, and he's determined to change how people are assessed and treated.
This is not limited to any one disorder. This is truly one of those phenomena, what we call transdiagnostic, across the board.
Miller's work focuses on the innate immune system, the part of the immune system that regulates inflammation. Inflammation is the body's natural response to wounding or infection.
And the immune system, when fighting an infection or healing a wound, takes up a tremendous amount of energy. And so the immune system is saying, hey guys, shut it down. We want to shut all the behavioral activity down. That's why you see the loss of motivation. I'm not motivated to do anything. I don't have the energy to do anything. And my brain's not working so great anyway. So people shut down.
Think about how you feel when you get a cold. You may feel sluggish, not motivated, maybe even down. This response usually goes away after you heal. But in some instances, the inflammation necessary to fight infection can persist and become chronic. Miller says inflammation can be a factor in all psychiatric disorders, but also in cardiovascular disease, diabetes, autoimmune and cancer patients, and he shares a story from 30 years ago.
The oncologists were giving inflammatory molecules called inflammatory cytokines to cancer patients as one of the early immunotherapies. And what they noticed is that the patients were becoming depressed.
What those cancer patients experienced was what was discovered in animal studies that showed when exposed to stress and a bit of inflammation, there are breaches in the blood-brain barrier where inflammatory molecules called cytokines enter the brain.
And have direct access to neurons in those areas. And one of the neuronal systems that's sitting in these subcortical nuclei, which is where it's deep within the brain where these cytokines are getting access, they're accessing the neurochemical dopamine. And if you want to shut somebody down, take away their dopamine. Parkinson's disease is a disease of no dopamine.
These inflammatory molecules drive down dopamine, a neurochemical that gives us feelings of pleasure, satisfaction, and motivation. Dopamine plays roles in controlling memory, mood, sleep, learning, concentration, and movement.
Generally, what we believe is that about 30% of people who are depressed have increased inflammation as part of their issue.
Miller says if you block the inflammation, you reverse the effects. But which drugs are best for depression are not yet clear. There are a number of studies looking at several anti-inflammatory drugs to treat depression. There are also drugs to boost dopamine levels.
With the dopamine, we can replace dopamine. We can also give drugs that stimulate the release of dopamine. So if you were a patient with depression, with increased inflammation, you'd be better off with a drug that's targeting dopamine than one that is targeting serotonin.
One of the biggest contributors to inflammation in the body is obesity.
Probably the most important source of inflammation in modern humans is excess weight. Fat cells grow really quickly, they outstrip their oxygen supply, and they die. And the immune system sees that cell death as a wound. So if you go into fat tissue and you did a biopsy and you pulled it out and you looked at it in a culture dish, you would see that fat tissue is loaded with inflammatory cells. And those inflammatory cells produce a boatload of inflammatory mediators that get into your brain and then can change the neurochemicals, the neurocircuits in the brain, and ultimately your behavior.
Stress is another player in the inflammation mix.
Turns out that people exposed to early life stress, childhood trauma, abuse, neglect, have persisting inflammation into adulthood based in part on changes that occur in the genes as a function of that early exposure to trauma.
These changes in the genes, called epigenetic changes, changes caused by behaviors or environment, predispose people to inflammation the rest of their lives. Cancer treatment can do the same thing.
Dopamine's terminals are in the brainstem. That's where the machinery for making dopamine is.
Researcher and associate professor Jennifer Felger studies the impact of inflammation on dopamine in the brain, and if replacing dopamine reverses the devastating effects of inflammation on motivation.
We're currently running clinical trials and mechanistic studies to try to better understand what inflammation is doing in the brain in patients with depression that have high levels of inflammation like cytokines and CRP, and seeing if we can either reverse the effects of inflammation on the neurotransmitters, so actually giving neurotransmitter-based therapies, things that would increase dopamine or dopamine signaling.
So here are the mini brain.
And then there are the mini brains.
Mini brain means that the smaller size of the human brain. So we are going to show you.
Researcher and assistant professor Shixing Wen and his team grow these mini brains,
So we are looking at
creating stem cells from urine or blood, then generating a 3D organoid of the human brain.
It's tiny. It's about 5 to 6 millimeter in the diameter.
These mini brains have the same genetic information as the person they came from.
They are living and they have activities.
It takes 9 months to grow the brains.
Yeah, it's an incubator.
Wen and his team are focused on dopaminergic neurons. What happens when they expose the mini brains to cytokines, those inflammatory agents?
After the cytokine exposure, we measure the dopamine releasing, and we see that the releasing from the treatment definitely was reduced.
It goes down, right?
Yes.
They are in the dish.
When Wen exposes the mini brains to anti-inflammatory agents, there is a robust reversal.
Yeah.
The answers to future treatments
So this one's
will likely come from these minuscule marvels. As for the here and now,
Oh, you haven't looked at them?
we are not powerless when it comes to inflammation.
People can do something about their inflammation right this minute. They can, number one, find out what their inflammation level is, get a CRP blood test, and number two, they can start looking at their lifestyles and see what about me is contributing to that inflammation.
We're going to measure levels of inflammation in your body. All right, excellent.
This simple finger prick test for C-reactive protein measures inflammation in the body.
Now I'm going to add the sample to the testing kit.
My co-executive producer and I had the CRP test, and our levels were normal.
That means you are at the lowest risk category for developing cardiovascular disease.
There are many factors that can drive inflammation: stress, sleep, aging, disease, obesity. So how do we combat inflammation? With an anti-inflammatory diet, such as the Mediterranean diet, by losing weight, by managing stress with exercise and mindfulness. This helps to manage the body's autonomic nervous system, which has two parts: the fight or flight part, known as the sympathetic nervous system.
It is the sympathetic nervous system that drives inflammatory responses in the context of chronic stress.
The parasympathetic nervous system is responsible for the opposite of fight or flight, when we are relaxed, resting, or eating.
When the sympathetic nervous system comes on, the parasympathetic nervous system comes on as a sort of a brake. So if you strengthen your parasympathetic nervous system through exercise, yoga, Tai Chi, meditation, deep breathing exercises, all of these can abrogate or eliminate or reduce this effect of the sympathetic nervous system on driving inflammatory responses in the context of stress.
Miller is working towards the day when treatments and prescribing will be based on one's inflammatory status. Almost 40 years after that fourth-year resident got his first grant, he's not slowing down. He can't stop now.
I want to see this all the way to the point where we're actually able to make changes that will impact patients in a way that when they go to the clinic, that inflammation measures are gotten and treatments are given based on their level of inflammation. I want to see that through all the way to the end. And until that happens, it don't mean a thing.